Welcome back, everyone, and thank you for tuning in to our 7th episode of the Golden Life podcast. And this also includes the 4th type of cerebral palsy that we'll be talking about this week. Before we get going, as usual, I'd like to remind you to please subscribe, share, like, comment, and help our community grow and the channel grow. Without you guys, we don't have a YouTube channel, and I thank you for allowing me to be the voice of this YouTube channel. So, the 4th type of cerebral palsy that we're going to talk about this week is Hypotonic Cerebral Palsy. It is a type of cerebral palsy that's characterized by low muscle tone, which makes movement difficult and weak. I wouldn't say I have this type because I have spastic, but this type of cerebral palsy, sometimes I feel like it shows up in my disability because I have certain types of movement issues and weakness. So this is Hypotonic Cerebral Palsy. Has treatment options that will depend on the severity of the condition and the individual's specific needs. Here are 2 common treatment options. Physical therapy. Physical therapy has been a common theme in most of all the 5 types of cerebral palsy. A lot of people go to physical therapy, and as I mentioned earlier in the beginning when I was first talking about this, I really don't like it. And if you want to go back in the earlier videos, you'll see why I don't like it. But physical therapy can also be a very effective treatment for hypotonic cerebral palsy. A physical therapist can work with the individual to develop an exercise program that focuses on building strength and improving muscle tone. The therapist may also use various techniques such as massage and stretching to help improve individuals' range of motion. Massaging really does help cerebral palsy. It helps relax the muscles, along with taking baclofen. If you can put your children or your teenager or a young adult that has cerebral palsy on this, it would be really good for them. Which is a great segue right into the medications. There are several medications that help with hypotonic cerebral palsy that may benefit from the use of medication to improve muscle tone and reduce spasticity. These medications may include muscle relaxants, like I mentioned with baclofen, or anti-spasticity drugs. However, it is also important to note that medication should be only used under the guidance of a medical professional. So please, before you put your children, your young adults, or your teenagers with their disability on any medication, consult your doctor or your family physician to make sure that you're providing proper care for them and they're being well taken care of. But overall, the treatment for hypotonic cerebral palsy should be tailored to the individual's specific needs and goals. With proper care and management, people with hypotonic cerebral palsy can lead active and fulfilling lives. Thank you very much for watching episode 7 of the Golden Life podcast. Please stay tuned in for the next episode as we will be finishing up our playlist of the 5 types of cerebral palsy, which will then be on the channel for educational purpose for all of you to use and see at your leisure. Don't forget to like, subscribe, share, and comment as it helps the community grow. Stay tuned for the next video and take care.